Kayla. You are. I was trying to make sure I had everything set up, but that's okay. It's good to see you. I feel like I have been so off the grid that I've missed a lot of things over the last couple of weeks. And I'm trying not to hear myself on my other phone. Okay. It has. I think I've gotten into one or two of your lives in the last couple of weeks, so it's been crazy. But I'm ready to get back to my normal routine. Let's see. Oh, for some reason my music's not playing. Not sure why. I don't know what's wrong with it. Oh well, guess we won't do music today because I can't get it to go. I know. And it was working before I brought it upstairs, so it's probably a connection to the internet all the way up here if I had to guess. Not really sure. I've got to get with Craig. I've got several people that's been wanting to get the sugar manual, but I won't really push it out on the other page that are on the other publishing place it's at, because after you buy the book, their shipping is so crazy. And so I really wanted to get it on Amazon, but so we've added some blank pages to it, but he was going to help me format it down to a little bit of a smaller size book. So I'm hoping that we can get that done so I can get that on Amazon, because I'm not good at the formatting. All right, I give up. I don't know. The music's all the way up and it's not working. All right, let's see. Is it 10 yet? Yes. Today's really gonna just kind of be like open it up for questions and letting people ask anything that they may have had questions when we went over all the hormone stuff over the month of December. So I'm kind of waiting to see what all questions you'll have, and then I'm gonna open up the floor for you guys to make our recommendations for our agenda going forward on what we want to talk about, discuss. I was planning on jumping right into testosterone replacement therapy, but we've really only had a couple of guys that's been in here. I hate to just spend so much time on testosterone replacement therapy when I have more of a live female group. So kind of waiting to see what I need to do about that. But hey, Sandy. I'm having difficulties as usual, so I can't get any music to play. But anyways, so I'm going to go ahead and get started. My plan for today really was to open up the discussion panel with you guys. We went through everything I wanted to kind of put out on hormones. I think as we go, we'll probably delve off into it even more, because I know this is such a passionate topic and subject for us ladies. So we could spend the whole year doing nothing but talking about hormones, but I know there's things that everybody else would like to talk about too. So we can always, circle back to going through each one of these even more in depth as needed. But I wanted to see if you all had any particular questions that you guys wanted to talk about, ask me, so that we can't have music, Sandy. It's good that we don't need it, because it was playing until I walked upstairs and it stopped. So I'm not sure why, but anyways, So my plan was to really kind of just open up the floor to all of you guys to see what questions you have. I've actually gotten some questions from people like privately. They didn't want to just outright ask on a post or where other people could have it. So I actually made a list of questions to go through some of the answers that some of the most common questions I've got, even just some common questions that I've gotten in my practice as well when people are coming in about hormones. So we can do that. And then if you have questions, then if you type them in here, then we can get them pinned up and I'll try to address them as much as possible. Just know that anything that I recommend is recommendations. I'm not technically diagnosing or prescribing or treating you on this platform, but I'll be happy to help you find someone in your area that can if I'm not able to as well. But so if you have any questions, please put them in here. Sandy, if you don't mind, if you see some, if I start talking to other questions that I have been already asked off the platform or in private messaging, if I don't see the questions, if you pin them up there, then I will try to answer them for you. And then we'll go through this. And then I really wanted to spend, maybe a good 5 or so minutes before we jump off, really talking about topics that you guys would like for me to discuss going forward. All right. So, of course, one of the most common questions I've actually gotten on in the direct messages and from my patients they always want to know, what are the most common symptoms of perimenopause, or, oh, thanks for resubscribing, Sandy. Thank you so much. For our perimenopause and menopause, they want to know, am I in it? Am I going through it? And so many of our symptoms can overlap with so many things like we've talked about, but your hot flashes, your night sweats, mood swings, if you're still menstruating, having irregular menstrual cycles, the V dryness, sleep disturbances, and the W changes. So when you have those, hormones is actually one of the first things that's dismissed. Nobody wants to talk about those. They want to go down other avenues of, you're depressed, you just need to change your diet, you need to exercise. And I'm not saying that those can't all play into it, but so many don't want to address the hormones. So these symptoms should trigger your provider to say, we need to determine the root cause, what is going on. People, especially my younger, their 30s, they're coming into different changes and they want to know why they're experiencing irregular menstrual cycles. I get this all the time. And the most important thing for us to realize, especially when we come in our late 30s, early 40s, is our hormonal fluctuations during menopause. This does affect our ovulation and our menstrual cycles. So as you start to get into perimenopause, hey Kelly, thanks for coming in. She's one of my St. Joe people. I think Christy came in too. But it's important for people not to just dismiss your late 30s because they're like, oh, you're too young. You just, this is expected. Well, it is expected, but what can we do? I mean, maybe someone just needs a little progesterone because they've been on estrogen-based hormones or oral birth control most of their life. So it's very important that if you're going to a provider, if you are in your 30s in this group and you're having some of these changes, that you find someone that listens to you. Hey, thank you, Kelly. That means a lot. Another question, of course, that we always get is, how can you manage your hot flashes and night sweats? And I always want people to know that it's not always just about throwing a hormone pill at you or some form of hormone replacement therapy, because everyone is not a candidate for that. Whether you are a smoker, you've had a blood clot before, you've had some form of cancer. So I don't just automatically be like, oh, you're having this, let me throw you on some hormone replacement therapy. I so want to know what are some herbal natural supplements that we can use, because if I can recommend these to people that definitely can never take hormones, then I also can introduce these to people that are candidate for hormones, but maybe you don't need those. Let's try these other natural supplements before we have to go into the prescription realm of writing bioidentical hormones. So when you start experiencing hot flashes and night sweats, we know that this is usually because your estrogen levels start to decline, and they disrupt your body temperature regulation. So things like when we talked about lifestyle changes, hormone replacement therapy, and then non-hormonal treatments can help. And I'll talk a little bit more about those at the down below if we haven't gotten anything else. Hey, Miss Wendy, I'm so glad you got to join us today. Miss Wendy's from Indiana up that snow, and she's one of my horse friends. So then, of course, everybody, fatigue. We all know we are experiencing fatigue. Why do we feel more fatigued than usual? Hormonal changes, our poor sleep, and stress contribute to fatigue. And then, you know, as we get into our 40s, we're really maybe coming into perimenopause really good, or we're actually getting at the end of perimenopause and going into our, you know, true menopausal state. We really start to experience the V dryness and pain. And that is always most likely due to our reduced estrogen levels. And outside of lubricants and moisturizers, then I highly recommend some form of estradiol insertable V tablet or cream to start with, because that you want to target where you're actually having that symptom. Now, the Intra V kind does not necessarily help with all of the sweats and hot flashes, so I will have some patients. Thanks for using my sub-emote stickers. But I will use sometimes a patch if I need to treat systemically, and then I will use the Intra V tablets or cream to really just target people that are having dryness or pain down there. Hey, other Alex, thanks for stopping in. But it is not abnormal. When women come in, they think something is wrong with them because they're experiencing that. That's actually more common symptom than most of my people presenting with hot flashes or night sweats. More people usually have that pain or that problem more than anything, or they'll say, I can handle the hot flashes or night sweats. I can't handle this. What can I do? So like I said, usually treating right there at the actual area is want to be your first and foremost go-to. Some other questions I've had, you know, what happens to the hormone levels during menopause? Most importantly, your estrogen and your progesterone levels decrease, and this is what leads to your different symptoms. And it's why it's important that we manage with both of these types of hormones, because it takes both of these to actually balance you out. And so many people will just throw people on for some form of estrogen or estradiol and not use progesterone. And patients are like, I don't feel any better. And they really need progesterone replacement. How does the hormonal changes affect my mood? Why does it make me more irritable and depressed? So our hormones are a chemical in our body that's produced from different places: adrenals, pituitary. So when these hormones get out of balance and fluctuate, that actually impacts our brain chemistry, and that's what causes us to get irritable and have the mood changes. So, you know, when you present and tell patients or tell your provider, I have no desire, I want to go do this, but I just don't want to get up and go do it. And so don't know if this applies to your specialty, but I lost so much hair from kids. Advice, I'm 38. So, having the kids most likely had to do with hormonal changes in your body with getting pregnant, and then the changes in the W word, and then having the baby coming off. The only way, let me finish this one. So, getting a really good lab panel that I went over all those labs at the beginning of our sessions, and I have that really good actual little PDF little file and my Discord for all the people to be able to use to take to their providers. But you need a really good functional lab panel to get to the root cause. Your hair loss can be from so many things: iron deficiency. It can be from hormones. Most likely it usually comes from the stress on the body, which leads to nutrient deficiencies and hormone deficiencies. And then, Kayla, for your question, for us to know whether it's hormone versus life, we treat both. We get your labs, we determine the root cause. Do you have underlying abnormalities in your lab work that we need to target? And then we address life situations as well. Because I tell people all the time that have no other issues, they're truly just depressed. And, I said, I can throw every medication at you, that we have on the market. But if we're not fixing the underlying problem, you're not talking, you're not doing therapy, and you're not working through it, and you're just masking with the medication, it's still going to end up slapping you in the face once you decide you don't want to be medicated anymore. If you only mask with medication and you do not get to the root cause, you absolutely will never work through that. So I'm not a fan of just throwing someone on antidepressants and sending them on their way. I'm a big advocate for therapy in my clinic. I have a really good therapy group that works with me and my patients, and it's almost a must. If you want me to treat you for some form of psychiatric disorder, anxiety, depression, mood disorder, people that are schizo, bipolar, any of those things, if you're going to do that under me, you have to be willing to go to therapy, because at the end of the day, it will not fix it if you're not getting someone that can help you work through it, set goals, and achieve those goals. So, but at the end of the day, to know if it's hormones, we have to address them, make sure they're optimized. That's the things we talked about early, not just normal, Kayla. Normal labs does not mean that they're optimized for you. So that's the difference in a provider saying, well, your estrogen is where it needs to be. It probably is, but you're complaining and it's not optimized. So that's the difference. I hope that answered your question. And you know I love you, so I'll be happy to help you off this platform. All right, so I'm keeping up with questions as I can. As I answer them there, I'm going to move back to some of the questions I've gotten off the indirect messaging or in the clinic. Another question I have is, how do you know which hormone replacement therapy is safe for me? And so this, as your hormones start to decline, if I can reduce your symptoms safely with bioidentical hormones, I'm going to recommend that, because there is nothing any better than just giving your body back the hormones that God made our body with and optimizing them so that you can feel your best self. And if you're not a candidate for those, I have researched and studied so much that I usually have some form of herbal or natural supplement that we're absolutely going to talk about further down. But in most instances, there is some treatment plan for all patients that are complaining or symptomatic for hormone replacement, but which one is individualized. So for me to say, when I answered this question for the girl, actually in my direct messages, I told her, I said, I have to know you. I have to know your whole picture to determine which one is safe for you. It's not a cookie cutter. And you guys heard me from the beginning. My GYN, I'll tell you, I realized that my GYN was writing my hormones. And when I started seeing several of my patients that saw my GYN and they came in on the same exact thing I was on, I was like, there's no way we all had the same thing. So he had a cookie cutter cream that he used for everybody, and it didn't work. So there is no cookie cutter. You need someone that's going to listen to you and treat you individualized. Then I had someone that, asked pretty much why their SEX drive decreased and what they could do about it. And, outside of hormones, as we age, our hormones go down. That's a symptom, especially for us women. Our drive goes down, husbands are going up. And these come from a lot of things, especially for us women. I mean, we're so high stress driven that in itself, stress alone can destroy your libido. So finding ways to lower that stress and those cortisol levels are so important. And y'all have all heard me talk about my favorite product, the Cortisooth. And I'm telling you, I will sing that praise for the rest of my life, because I've never had something that truly an all-in-one like this that did it for me. Now, that doesn't mean it's going to do it for you, unfortunately. I wish I could guarantee it for everybody, because it's been a game changer for me. And if you watch the recent video I did, my patients have heard it so much that I'm not joking. When I came in from my trip last week and I thought, I've got to go till the 18th of January without this medicine, what am I going to do? And I got there and I had the sweetest gift of 3 bottles. I started crying. So, hubby is 40 now and drive has increased, and I haven't understood. Now I know. Yes. So, actually our guys will really start to get very heightened in the 40s. and they may not be able to perform as good because that's part of it, but for some reason our guys definitely, their drive goes up around the same time ours is going down. Now we actually start to see these, as us as women, our drive, crazy as it sounds, tends to get between like 48 to 50. You'll start to see women really kind of have a higher drive, and then the men's kind of start to back off. So it's almost like we can't get on the same page for a little bit. But when you regulate hormones, because I have so many men that I was seeing first, treating their levels, and then their wives come in and said, you're going to have to do something for me because I cannot keep up, but I want to. And so, I've gained a lot of women based off the fact that I have so many men in my community that I take care of doing testosterone. Good morning, Miss Andrea. It's good to see you. So yes, Kayla, unfortunately, we cannot get on the same page, but if you have a provider that would treat husband and wife, then a lot of times that can help. I hope I didn't miss anything. And I forgot to tell you earlier, Kayla, because you came on and you said it earlier, I'm so proud that the lemon water has helped you with your retention and voiding issues. That is amazing. I'm so glad. All right. Now I'm changing the topic up a little bit. Going to talk about, hey, Miss Missy, thanks for coming in. We have to definitely get together and do one. We need to decide on a topic that we would like to talk about together. So physical health component of hormones. The biggest question, everybody comes in, they're like, why am I gaining weight? And especially around your abdomen section. So, outside of hormones, we know as we start to age, thanks for keeping me in line and making sure I don't miss all these lives. Sandy's good. I know I couldn't do it without her. So, slower metabolism, we know, as we start to age, slower metabolism, then, I think things that we don't take into consideration is when our hormones start declining and our metabolism starts declining. Thank you. We're also at the point of our busiest time in our lives as women. We have either, had our children or they're teenagers, and we have full-time jobs, and the things that we used to do, making time for ourselves, the self-love, the exercising and doing things, we don't do those as much as we get into the time when we actually start losing our hormones. So then we start seeing weight gain just for the pure fact that we've had lifestyle changes. We have such a busy life that finding that time for ourselves is hard. So that is one thing that's never really considered when my 40-somethings come in. Thank you for coming in, Brandy. When they come in and they're like, why am I gaining all this weight? I said, before we talk about hormones, let's talk about a difference in your lifestyle. What are we seeing differently? Now, you do have the ones that are like, Monica, I've changed nothing, and exercise, I eat the same way, I do all the things. And of course, we know we've got to get to the root cause of that. And that's where that functional medicine panel that I provided early on for labs and things that we need to determine what could be going on. How does menopause affect your bone health? This is so important, and y'all heard me talk about this through our December sessions. When we start to develop things like osteopenia and osteoporosis, it's because as women, we're losing our estrogen. So when we replace that, that definitely helps to decrease our risk for osteopenia and osteoporosis. So that is one of the biggest benefits of starting bioidentical hormone replacement therapy early. Are there any changes, to heart health, cholesterol levels that you should be aware of? This is a question that I get asked in the clinic quite a bit. So, we've all heard and been taught most of our lives that hormones, they're bad for your heart. They're bad for everything. We're on a new wave now, thank goodness. But people don't realize that menopause itself actually increases our risk for heart disease more than actually doing bioidentical hormone replacement therapy. So getting a good provider that listens to you, gets these labs, determines that, if we get you started on the right bioidentical forms of hormone replacement therapy and you have a very healthy diet and an active lifestyle, you're going to decrease. Yes, I've always been scared of HRT in practice. Missy, I would love to be able to help you with that. I was too in my early careers, because as well as I do, they don't teach this in school. This has been self-education, going to clinic, and going to conference after conference for this. So I will be very happy to help you feel more comfortable with this as a provider. But anyways, so it definitely doing bioidentical forms of hormone replacement therapy and having an active lifestyle and a very healthy diet is the best way to actually lower your cholesterol levels and decrease your risk for heart disease. Then talking about lifestyle management on the aspect of hormones. What lifestyle changes can help? We know a balanced diet, regular exercise, what we've all been talking about, stress management, and then things that trigger it. Caffeine and alcohol are two of the actual, outside of grains. Grains is the worst thing you can put in your body, but those are two actually horrible things that actually contribute to changes and fluctuations in your hormones. So we want to limit those. Specific foods and vitamins that you can consider. And I know most of you that know me well have heard me all talk about our vitamin D3 plus K2. You have to have K2 with your D if you want to pull the calcium out of the artery and get it to the bones and muscles where it needs to be and not be building up all the calcium in the arteries. So D3 plus K2, you need your omega-3s. Omega-3s are so important for inflammation. They decrease inflammation throughout your entire body. Omega-3 at the dosing of 2,000 milligrams is better than a pain pill. If you combine omega-3 with turmeric, then you've got something that's amazing outside of pain medication. And then foods like soy and flax seeds. If you remember when we go back and talk about what estrogen was made from a horse's pee, but estradiol is made from soy and yams. So those, if you have those foods and high in eating like yams and soy, that's going to help with hormone balance. So happy I have you and all this wonderful info. I know, Christy, I'm so excited. I mean, yes, I'm glad you're my patient. Let's see, Kayla, grains has been the toughest for me. Hispanic meals always contains rice. And you're right. And Kayla, I have a lot of Hispanic patients. They drive over from another connecting community to my practice. And they are one of the hardest populations to get off of grains. But I've done it, and there's some that's not, and they never will, but some of the younger generation of them has really been able to adapt this lifestyle and realize when they started seeing improvements in their labs, their CRP markers start going down. They can see the inflammation go down. They see the puffiness in their face go down, the numbers on the scale. So these are all things that grains absolutely do to your body, and I challenge my patients, if they're going to do one thing, and we have to accomplish one thing, get rid of grains first. Hey, Mama Ash, thanks for coming in. That is the biggest challenge we have, but I will tell you, if you can cut out one thing in your life and cut out grains, you're going to see a huge change in how much better your body feels, the gut health, everything. So specificity is important. So exercise, what types of exercises are great? Hey TK, thanks for coming. So exercise reduces symptoms and improves our overall health. What can you do? The best exercises, we don't want to stress our body. So let me tell you, Liz Monica, that's an avid runner, running 30 miles a week. My husband and I live and feed off of this. Not everyone could go run 30 miles a week and lose a LB. God, I hate not being able to say certain words, because some people, that stresses their body out so much that it increases your cortisol and you will actually gain. So I want you to understand that cardio doesn't mean you have to go run. You don't have to run a race. You can walk. Here's the thing with walking. If you have a walking partner, that's great. I encourage everyone to have someone to walk with. If you fall, you get hurt, a dog gets you, whatever, you have someone there. You should be able to talk to them when you start out, but you absolutely should not be able to have a conversation by the time you finish that walk. Otherwise, you did not get that heart rate up. You're not done anything really cardiovascular wise. But would I rather you walk and talk than sit on the couch and talk? Yes. But if you really want to get good cardio for menopause, you can start out walking, but you should be labored. You should be short of breath and should not be able to carry on a conversation at the end of that walk. So let's see. Then, strength training. us women, unless you're trying to be that beautiful Sandy back in a few days ago that was smoking the body competition. Unless you're trying to be one of those, you do not have to lift that type of weight. You just need to tone. I tell people everybody loves to watch a 30-minute TV show. While you're watching that TV show, get you a 2 or 3 pound weight, sit there, do arms up and down today. When it goes to commercial, take a break. When it goes back to the show, then do it. You're not counting reps. You are absolutely just working those isolated muscles each day. The next day, go out like this. The next day, do this. You don't have to go and just tear it up in a gym to get in strength training. Just isolate a muscle and work on it each day. And we all know we watch some TV, so that's the best time to do it. When you're distracted, you're not even paying attention to the numbers. My friend Craig just came. I was talking about you earlier. Girl, Missy, I know. I tell people too, I say, you don't have to spend money on weights. Go get that corn. Any bit of resistance is more than what you do. I even tell people walking. I understand, especially this time of year. If you only have 30 minutes, like I can go walk 30 minutes today, but after 2 or 3 weeks, that 30 minutes is not doing it for you anymore. Throw in a little weight. You don't have to walk for 45 minutes to an hour. Put some leg weights on, some arm weights, something, a weighted vest. If you increase the resistance, you still give yourself only that 30 minutes that you have to invest in it, but you're making it a little more difficult. So those are the things that I recommend in my patient, because I don't listen to excuses. Well, I don't have time. We all have time, but what we do with our time and how we utilize that time is the difference. Yep, 4 bags, vision board. Sorry, I'm trying to keep up, y'all. I have a 6 weighted vet. I just ordered those cute little pink wristlet and anklets off the showcase. I have 6. Okay. So exercise, we did that. Sleep and mental health. This is some of the other questions that I got. And like I said, y'all keep asking questions in the feed. If you have anything you need to ask them, and I'm going to answer the best I can, or we'll talk about it later as well. Biggest, issue. You all know this is my biggest issue. Out of all the symptoms hormonally, this was it. Miss Wendy, you have a hard job. You work a full-time job, and then you got to do that farm work every morning and every night. And in Indiana right now in that cold and snow, it is not easy. I dread when my husband goes out of town, when I have to get up and go feed all the animals and all the horses myself. I don't like it this time of year. So why am I having trouble sleeping? This, every bit has to do, honestly, estrogen, yes, but that progesterone decreasing really contributes to our bedtime routine. And you heard me tell you when we talked about all the different hormones, if you do not have a uterus intact, your provider is going to say you don't have to have progesterone. And this is true, because progesterone is there to protect the uterus lining with estradiol replacement therapy. However, I'm going to tell you, if there's one hormone that's on the market that you absolutely want as a female, whether you have a uterus or not, is progesterone. It's where it's at. It's got the best symptom relief. Estrogen just helps to promote it. But if you don't have that up and balanced, getting that progesterone level close to between 10 and 20 is possible to be optimized. No matter what I do with your estradiol, you're not going to feel your best self. Hey, Miss Jeannie Cannon, thanks for coming in. Hey, Jackie, thanks for coming in. If y'all haven't seen, Jackie did the cutest little book review on my sugar manual. Y'all have to go check it out. I added it to my story. Let's see, how can I manage anxiety, depression? This goes back up to where, Kayla, you asked that question earlier. Once we get all the labs that I recommend, so I can determine, are we optimized? Do we have a nutrient deficiency? Do we have, hormones, thyroids, other things that's going on? Once I have that clinical picture, then we get into what can we do holistically. Practicing mindfulness. Therapy is an absolute must. Thank you so much. And medication. But here's one of the biggest things. I keep talking about grains, It's amazing what that does and triggers in your body and how it sets the standard of what your body craves and needs for the day. So cutting out grains starts decreasing inflammation. Your gut health goes down. You know where we produce the most serotonin? In our gut. So when our gut health is not good, it's leaky, and we're not having good gut health because of mostly grains, then your serotonin levels are severely affected by that. So that's why we have so much issues with our mental health. So cleaning up that diet, therapy is an absolute must. Like I said, I am not treating anxiety, depression. I may do a little anxiety, especially if it's an acute, it's social, something just happened, you're having, you just lost a loved one, something crazy's going on. I may do a little bit of like acute anxiety without therapy, but people that are truly majorly depressed, therapy is a must in my office, because at the end of the day, we're just masking it with medication. Exercise, social support is so important. Surrounding ourselves with this amazing community that we have here is so great for your mental health. I never imagined the people that I was going to see TikTok videos that says that's why they're on TikTok, is because it has improved their mental health. Being able to surround yourself with people here that are encouraging, lifting you up, supporting you. You saw my comment in Sandy's Discord yesterday. It's amazing to me how many people that I know here in my community that view every post I make. Every post, they see it, but they do no engagement whatsoever. But I'm like, why? I engage on every one of yours, but you don't engage back. But you found this other tribe that we have found here in Sandy's, squad, that we engage. And let's see. Rose says, what are your thoughts on ashwagandha? It's the best thing to me that's ever happened. It's the number one product in the Cortisooth that I recommend. Cortisooth combined. Now by itself, you got to have the things that when you are using ashwagandha, the most important thing for people to understand is most of your nutrients, your vitamins and supplements all have some form of a cofactor that is important for, I see your question, TK, and I'm going to get to that. But the almost all forms of nutrients and vitamins all have some form of a cofactor that's necessary to make those work in your body. And like with ashwagandha, it works its best, honestly, by combining it with L-theanine and GABA. If you take ashwagandha with L-theanine and GABA, you're going to actually promote the ashwagandha results in your body. So honestly, Miss Jeannie, if you have your cortisol levels are off like that, then you would honestly benefit from combining some form of ashwagandha, L-theanine, and GABA together. The valerian's root and lion's mane are really great as well, and that's one of the reasons why the Cortisooth is so great. There's only one product on the Cortisooth that I'm really iffy about, and I wish it wasn't in it for people when I promote it for bedtime, and that's the rhodiola, and that's because it's a more stimulant based. So I wish it was more in its component, the inositol that they promote their other product with, because it's actually more stimulating. But most people, it's not enough, so it don't affect them for bedtime. But Miss Jeannie, I'll message you, and if I don't, because my brain gets distracted, you can always send me a message and just ask me. I think you're my biggest engager. Oh, thank you, Miss Jeannie. I try. I spend my 30 minutes on Friends, 30 minutes on FYP, and then I spend my time in the Discord. So I really do my best. I was off during the week while we were on vacation because we didn't have the best internet. But let's see. So I think I answered both of y'all's questions about cortisol. And I think that I'm actually going to use that as one of my topics to really delve off into cortisol. I didn't talk about that a lot with hormones because honestly, when we talk about treating cortisol levels, it's more herbal, natural treatment than it is prescription anyways. But I think we'll add that as one of our just Tuesday topics to really get more in depth on it. Katie message, I got to run to doctor's appointment, Babonic. Yes, I want to know how that appointment goes today, and you be very assertive like I told you. You tell them what I want done. So, anyway, crap, I hit the wrong button. So, but yeah, text me later, Craig, and let me know. All right, so back to TK's question, because she had it pinned up there and then I was finished up talking. So when we talk about grains, the grains that we all pretty much know about, of course, is going to be like your brown rices, your breads. People, they'll come in, they're like, oh, I'm doing so good, I eat the whole grain bread and oatmeal and all these things. All that stuff feeds inflammation in your body. So then people say, but isn't it good with fiber? It's not enough fiber, and it's not enough good fiber for us to really promote grains, because that fiber in there cannot eat up enough that cause all these little pockets in your colon. So if you've ever heard people talk about diverticulosis, and you get all these little pockets, what happens is these things feed inside of those pockets, and that's what causes inflammation, infection. And it's not just in the diverticulum. That's what causes our leaky gut, an abnormal gut health that we talk about. So we really promote getting off of grains altogether, cutting it out. But it's hard. It is not an easy lifestyle. And you're not going to hear me promote these fad diets. Chris and I pretty much live a very high quality carnivore lifestyle, but it's because it's what we enjoy. But I can't say 100%, because he likes asparagus and he likes broccoli and things like that. So we do have some green veggies and stuff from time to time, but to bring in rice, oats, and things like that in our lives, we don't have that. We don't use that anymore. I will tell you, when I talk about these fad diets, because that's what they are, unless you truly commit to the lifestyle, and that's what makes it different. Carnivore is what I highly promote it, because it really decreases inflammation in your body. If nothing else, you will see a change in how swollen. If you don't, you may notice, this ring, when my husband put it on my finger almost 7 years ago, he had to shove on my finger. And now all I do is sit here and do this constantly. He's like, I've got to go get your ring resized, because ever since he put it on my finger, it was always too little. But when I cut out the grains, that's when all the swelling in my body started going down. My provider had done everything, diuretics, all the things to try to get the swelling off my ankles and my feet. I cut out grains and it was gone. So Mediterranean, I do promote Mediterranean, Kayla, and for you, I think that would be great. Now, I am a red meat. I believe in red meat. I believe in butter, and you're getting your best nutrient-dense foods with red meat. But I understand you're pescatarian, so I promote red meat because I don't have a different lifestyle. But if you can do Mediterranean and you're giving up red meat, that is fine. But just try to not be as grain heavy. Do you can do the fruits and stuff. Just keep in mind that we have to, with our fruits, we got to have good fiber. That's what makes your fruits better for you than the sugar that's in a candy bar. Because at the end of the day, the sugar from a strawberry and a sugar in a Snickers is the same sugar. The fiber that's in the strawberry is what helps that sugar eat up and be better for you than the Snickers bar itself. But at the end of the day, they both turn to the same sugar molecule. You go back to chemistry, it's sugar. But yeah, red meat is great. And different people, like my daughter, I know you have HS, and my daughter has it significantly bad, but red meat doesn't trigger hers at all. So she has cut out grains. She actually had eaten some over the last 2 to 3 weeks. She said at holidays and doing the different things. And her little face, I know she's pregnant, but there's a difference in the pregnancy face she was having. Her little face was so inflamed and swollen at her shower Saturday. And she really had nothing going on prior to that, because she's really cut out the grains and stuff. So it really triggered that for her, but she can eat red meat. So everybody, even with HS, it is not a one size fits all either. I've made you some recommendations. I think you saw those, and provided you some resources to look at for that. But at the end of the day, the biggest thing we recommend for HS is absolutely cutting out grains. It is the biggest thing you can do for HS. You will cut down that inflammation that causes that sebaceous inflammation, those cysts there, that causes that to start tunneling. You cut out those grains and you'll see a huge difference. So yes, Miss Lori, bread and potatoes, I'll tell you, that was the hardest thing to give up. But once you do, your body will stop requiring it and you will not crave it anymore. And you've probably heard that and you're like, oh yeah, whatever. But it does. I mean, I tell people I was never a sweet eater, but I could sit down and eat some chips and salsa or some chips and dip or eat some potatoes all day long. But I don't crave it anymore. I mean, I'll take some cheese dip and put it on a 3-net carb tortilla wrap and make my chicken wraps on it. But that cheese dip is less than 1 gram of carbohydrates. So I'm still not loading it up, but I'm not having all the chips that went with that dip. So there's definitely ways to be able to get those things in, and not have to you have all like the refined types of potatoes. Your chips and salsa were life. But TK, you can have that chips and salsa right now. I will take a picture and send y'all. I mean, like, I have a container this big from Sam's of their white queso and their cilantro salsa. But I absolutely take a teaspoon of that. I smear it on my 3-net carb tortilla wrap, and then I put my Southwest chicken and things on it, and I use that cilantro sauce on it. That wrap comes out to 27 grams of protein, y'all. 27 grams. And I don't have all the bad carbohydrates and stuff with it. So you can make this lifestyle change. It's just, it takes commitment and doing some own self-researching on the best ways and what you can do. Because like I said, everybody is individualized. There's no cookie cutter for this. Some treatment options. This was just some of the basic questions. So when I just spit out some quick answers, we went through, all the different types of treatment options. But so I had someone asking about natural remedies or alternative therapies outside of, like I said, just me prescribing you estradiol, progesterone, testosterone. So our biggest things, of course, are going to be your vitamin D3. We've talked about that. Your magnesium. Magnesium is absolutely so important. Number one, because it's one of the biggest cofactors. In order for your vitamin D and even your omega-3 to get to the cell where it needs to be, you got to have magnesium. If you're not getting magnesium with those, they're not going to transport and you're not getting any benefits from it. And that's why, I was surprised when I found this product that it was on TikTok Shop. It's something that I've used forever. I recommend to my patients forever, but it's a combination of CoQ10, omega-3, red yeast rice, and magnesium. That's your top 4 ingredients. Then you get down to the bottom and it's got your D3 plus K2 in it. Also has your black pepper, your zinc, and your niacin. So it's an amazing all-in-one product, but it has all the cofactors that you need. Me and 2 other NPs in the office are loving this live. Oh, Missy, that makes me so happy. We really need to connect because I promise I love giving back and I will be so happy to help you guys. I do a lot of Florida sessions. I go all over the state of Florida and do conferences. And I am actually fixing to be partnering with the Elite Nurse Practitioner that's nationwide and doing conferences and speaking throughout the United States. So we can definitely get together. So then omega-3, like I told you earlier, that supports anti-inflammatory pathways, hormone production. And then myo-inositol, absolutely amazing. But most important for my childbearing women, let me make sure you understand this, because you're probably seeing this product that's combined with that amazing Cortisone that I talk about, I love, and now you can get the myo-inositol, and I've ordered it. I just actually ordered it, I think off of Sandy's TikTok. I can't keep up. I try to share the love, but I think I just ordered this combination off of hers because I wanted this because I take these products individually. So I'm all about trying to find how I can take and decrease how many pills because my husband laughs at my bowl of breakfast in the morning. But anyways, the myo-inositol is absolutely amazing for improving your insulin resistance in your body naturally without all the shots that we hear people talk about. It decreases insulin sensitivity, but here's the thing for childbearing. It increases your pregnancy risk. So just like when a patient gets put on these G shots that everybody talks about, and we have to say, we need you to use other barriers of method so you don't get, pregnant. The same thing happens here. When we improve insulin sensitivity in your body, it increases your risk for pregnancy. So if any of y'all start these because you see them and they sound so great on the shop, just know if you're childbearing and you start improving this insulin resistance in your body, you absolutely can get pregnant. My little baby girl is living proof. So anyway, so that is an option. Then, of course, we have Chastiberry, which helps support progesterone production in your body. Ashwagandha is the most amazing herbal supplement to help manage stress and cortisol levels. Did you laugh at me, Kayla? Will it like offset? No, it doesn't offset your birth control. So if you're using a barrier, that's great. I have so many people that are not on, I've got a lot of people in my community that does not do any form of birth control. They're like, just pray to God that they're keeping up with their cycle and doing this little ring on their finger. And anyway. So I just have to make sure I tell you that if you're not, and I'm telling you this is a great supplement, I want everybody to know that there's a pregnancy risk, because I don't want you getting pregnant on my dime and be like, you told me to take it. So it's so important just know that it does. And it's only because it improves your insulin risk. So even if you're taking the shots, that's the biggest risk with it. Now, those shots absolutely do offset your birth control. And if you are taking those and no one's told you that, because it slows down gastric emptying, if you're taking an oral form of birth control and you take those shots, when that birth control gets into your belly, it is slowed down gastric emptying, so it slows down the shots that everybody wants. I'm not sure if I can say them on here. I don't want to get in trouble. But it's the the GLP type shots. And I'm a big promoter of those. Yes, TK, that's it. So, but they absolutely affect your birth control. We tell everybody with every dose change, you need to use another form of contraception to prevent pregnancy. So if you started out on the low dose and then you go to the next dose, you need to spend the next month on using some other form of contraceptive, because for every dose change and your body acclimating to that and the gastric emptying in your body, you need to do something to prevent yourself from getting pregnant on these shots. They are not studied in pregnancy. I have not had anybody that's had any birth defects. I tell everybody I've got tons of, I'm going to say the word and hope to the gods I don't get in trouble. I have tons of Ozempic babies. No matter how many times I tell them to use another form of contraceptive, you can absolutely get pregnant on this. Y'all, I had a patient that had spent money on IUI, I think upwards of about $20,000 trying to get pregnant. She came off. She became my patient after about right around between 2 and 4 months of on these shots. She got pregnant. She knew that I did not want her to get pregnant on these just because it's not studied yet. But she's got a miracle baby and he's perfect. He's absolutely perfect. And I tell everybody he was my first Ozempic baby. But I can't promote that because the studies don't show that, hasn't been done on pregnancy. So anyway, decreasing insulin resistance sensitivity in your body increases your risk for pregnancy, because that's the biggest reason why you're not getting pregnant. That's where all the PCOS comes into play. So then the maca root. This helps support your energy and hormonal balances. That other supplement you've seen me talk about, it's the Minnow. If you don't do something to change the chase, it will be on your dime. Connie Lamberson, I have no clue what that's supposed to mean. Change the chase. You're going to help me understand. But anyway, the maca root, that Minnow that you've seen me talk about in the blue bottle, it says Minnow on it. It has a good bit of these in there. It has DIM in it, which is one that I didn't actually talk about here. I got it in parentheses up there. But all of those are actually in that one little product. So how does Sandy say it? It's less than a half a cup of coffee a month to subscribe. And I have really built out my Discord. I've got lots of stuff in there. There's still lots of stuff to come, but the best thing that's about my Discord is it has the wonderful lab manual that I recommend taking to providers. Even my providers that are in here, It's in there as well, and I provide diagnosis codes on there that helps you get these labs approved. Minnow question: if you're perimenopause, can you experience more? In the beginning you can, because you're starting to change the fluctuation of your estrogen levels. So it's as you have no estrogen and now we start driving up estrogen levels, sometimes until we find the right amount or dosing, or even like, because I tell some people, you may not be able to take Minnow every day. You may have to go to 1 capsule a day, or you may need to go to every other day or 3 days a week. Just because it says you can take 2 capsules a day, that may not be what you need to take personally. So because you think about when you was that 10-year-old, 12-year-old, whenever you came into menstruating, that's when all your symptoms, you started shedding and bleeding and cramping and hot flash and headaches and different things that could come along with your menstrual cycle. That's because your body came in to make an estrogen. Connie says, think last office visit. That's going to be hard, but I'll think about it. I just think about memory, and not having a memory is what I think about. But anyway, oh yes, no, I do, Connie. Now I'm laughing out loud. So anyway, back to that. So same thing now. We lose our estrogen. Then once, we start getting to perimenopause, menopause, then we start taking things that helps to replace those. You absolutely can start having heightened effects. It's a little worse. So I'll tell people, maybe you just need it 2 or 3 days a week. You don't need it every day anymore. So if you are one that's having that, or if you're asking for someone else, whatever it may be, Sandy, then okay, I have been fluctuating. So maybe let's find, like, if you're having more fluctuating, then back off and say, let's try just taking it 3 days a week instead of every night, because you don't want to heighten yourself to the point that you're having too much of those symptoms. So you may just not need as much. So play with your own dosing and see where you can find your happy spot and how many days a week you may actually need that, or if you can tolerate just 1 a day, or 2 to 3 times a week. And if if you have other questions, that just message me, girl. Let's see. Did I miss somebody subscribing? I feel like I saw something yellow go across, and I feel like I missed it because I was talking. Yes, Miss Karen Minger, you need to be taking those iron supplements. And I checked yesterday. I think you've had at least one of your infusions already. I checked in on that. So, but yes, I want you to do that for Rochel iron. Let me see. Trying to find it. That we would have talked about in there, but this is the one that I typically recommend because it's very, gotta love these games, puzzle pieces. Sorry, y'all. Hang on. All right, so it's feeding back. Sorry. I must be too boring. TikTok wants me to play puzzle pieces. But this is the Rochel iron that I typically recommend. It's very gentle on the stomach. It doesn't cause a lot of pains and symptoms, constipation. Missy, thank you, Missy, for subscribing. I thought I saw something yellow go across there, but I missed it because I was running my mouth. I'm sorry, Missy, but thank you so much. I will send you a message afterwards with the actual direct link. So if you'll pay attention to your private messages from me, I'm going to send you the direct link so you get into my Discord for sure. But that's the iron that I recommend. I also highly recommend to people that do not like to eat beef liver like myself. I take a grass-fed beef liver capsule because it's one of the best forms of heme iron. So I take that in addition to this particular iron because I have struggled with iron deficiency anemia my entire life. And my office staff can tell you I went from having a critical ferritin level of 3. Missy, do not laugh at me because I seriously had a ferritin level of 3, and I should have gone and got iron infusions, but we're the worst patients and I don't have time for that. So I hit it hard with this particular iron and started my grass-fed liver, and I can happily say that my ferritin levels are 58 now. Goal is to get them optimized between 60 to 80, but I'm so excited with 58. And I can tell you, palpitations was the worst thing I was experiencing with that, and those are almost completely gone now. I have an underlying tachycardia issue, so it'll never be gone, but that was so triggered by that severely iron deficiency. And this particular iron with the grass-fed beef liver capsules improved it so much. But you also need your vitamin C, because vitamin C is the binder to your iron. I keep 500 milligrams of vitamin C on me constantly. If my husband and I have a steak, I'm taking the vitamin C right then so I can absorb the most heme iron from that steak as possible. So definitely recommend those, Missy. I have a good bit of natural things. I don't know if you go to my TikTok page and look up on my link tree, I have in the link tree I have a shop in there. I'm not sure if I'm gonna get in trouble for saying this. I don't think I'll get in trouble for link tree, but anyway, I have different folders for different products that I recommend that's more natural and holistic. If you want to just take a look at those, it's broken into like stress, anxiety, anti-aging, immune support, protein, different things in there. That's just got some of the things that I recommend in there. Thank you, Wendy, for subscribing. I will also send you the direct link when we get out as well. To the Discord. If you haven't, you'll need to make sure that you've downloaded the Discord app to be able to get in there as well. All right. I think I'm just about finished. The last one I wanted to talk about supplement-wise was zinc. Zinc is so important for acne and inflammation. Now, let me tell you, I don't recommend zinc every day for the rest of your life. And zinc can be harsh on the tummy. It is hard for me to take zinc. It's probably one of the hardest supplements for me to take. I get really nauseous on it. So it's kind of one I've eliminated. It is in this very small dose in the omega-3 CoQ10 red yeast rice product that I recommend. But it's very low dose, and I've actually tolerated it. Some mornings I don't. I take that supplement in between bites of a healthy fat. So usually I'm having boiled egg or my shake in the morning, and I'll have some of that. Then I take my supplement, and then I finish out what I'm doing, which is important anyways, because those are mostly fat soluble vitamins. So you want to take it with a healthy fat anyways. Long-term health. This is the last little section I want to talk about questions. I kind of grouped all these into categories when patients ask about them. So long-term health, people want to know how long can perimenopause last? Subs that make me nauseous, I take before bed while I sleep. And some of those are okay. Now, I will tell you, you never want to take a vitamin D3 supplement at bedtime, which most people don't complain of nausea with it. But D3 actually affects your natural melatonin and actually can trigger not being able to sleep. So anything that has a D3 in it, just make sure you don't take that at bedtime. People don't realize that. But how long does perimenopause last? I mean, of course, there's no set, yeah, I like sleep too. I love my sleep these days. And how will you know when you're in menopause? So there's no cookie cutter for how long is peri going to last, but perimenopause does typically last anywhere from about 4 to 10 years. It depends on when it started, if you're going to be closer to a 10-year mark versus, 4-year mark. And I'll tell you, you can, kind of look at what did your mom do? Her sisters, kind of first degree, you're not getting too far off from that. But we are seeing menopause happening a lot later in life as well. And that is most likely triggered by the changes in how we've been eating. All of these hormones-induced foods has really triggered changes in our menopausal cycle. I was peri at 27 with old eggs. I would look at some genetic disposition with you to see, when you got pregnant with your little boy that's 4 now. Oh, Kelly, thanks for subscribing. And I'll send you the link too, but y'all just make sure that if I don't, because my brain is scatterbrained, I need to write these things down, that y'all message me for that direct Discord link to get in. But But anyways, did you have to do anything to get pregnant with your little boy? With you being peri at the age of 27? Kelly, you can use those cute little sub emote stickers too now when you're in the comment section. You can click on the little star and use the sub emote stickers. Anyway, so what are the long-term health risks? We know without hormone replacement therapy, as your body starts to decline, your increased risk for osteoporosis, heart disease, and then of course the changes on the scale. Kelly, Missy, and Wendy, I'm so excited to have y'all. And then how can you maintain your overall health after menopause? So, once you go one whole year, 12 months in a day with no menstrual cycle, we were on infertility for 1.5 years, stopped, and over a year later got pregnant. That's because God wanted you to have that sweet baby. That's what I tell people all the time. God wanted you to have it. It was in His timing. Early menopause, premature ovarian failure at 27 is hard. We talked about, I swear I feel like we're made from the same pod, just different peas. But because mine started at 25, but I ended up having to have the full-fledged hysterectomy at 25. But after you get through menopause, 12 months of 1 day without a menstrual cycle, now we're determining you're menopausal. People that have hysterectomies like me, you don't have that menstrual cycle to guide that, so it's a little harder for us to determine now you're fully fledged postmenopausal. We guide that by hormones, but even your peri days can get you in the same levels as postmenopausal. And if you're still having a menstrual cycle, you're like, well, I have menopausal labs. If you still menstruate, it's a 1 whole year and a day without a cycle. But after you get through that, and we're doing hormone replacement therapy, the most important thing you can do to stay healthy is a healthy diet, regular exercise, maintaining your regular, your checkups. If you've got someone that practices holistically, that's amazing as well. And the most important is managing stress. I can't emphasize that enough. And we live in a stress-driven world, especially us women. We carry so much stress. Individual experiences. Why is my experience of menopause different from other women's? This is the one thing I tell people that come in. Don't compare. Please don't come in and tell me, well, my best friend's getting the pellets and she's done amazing, but then I got the pellets and I felt worse. There is no cookie cutter. This is individualized care, and we should not be comparing ourselves to our sister, our best friend, because it's working for them, just like this cortisone that I think is the best thing that ever happened. I'm mad at myself that I didn't start this years ago. Doesn't mean it's going to work for you. So, and then the most common question is, what age can you expect menopause? Used to you thought, I'm going to hit 40 and I'm going through it. Menopause, not peri, but menopause, usually we're seeing now anywhere between 45 and 55. I have someone right now that's 58 years old, and we've just now finally diagnosed her as true menopausal. So it is actually getting later and later each year. So I have ran through the most common questions from my perimenopausal, menopausal questions that I've either gotten in the messenger or from my personal patients that come into the clinic. If you guys have any other questions, otherwise I know we're at the hour mark. I really wanted to spend a few minutes and seeing what topics, I'm going to put these in my phone, that you guys are interested in, so that I can get the agenda made up for hopefully January and February. So if you guys wonder if society created that women having babies and deciding to have babies, wonder if society created that women having babies and deciding to have babies later. Must have missed something. How do we manage that stress level? Well, managing menopause later. I hit the wrong button. Wonder if society created that women having babies and decide to have. I still don't understand it. I'm sorry. Oh, thanks for coming. Thanks for inviting Chastity TK. We're having baby. We are. We're seeing a lot of babies later in life, and we had the fear of, you don't have babies later. Sandy, I've got to know, because now I'm so confused, and I don't like to be confused. But we were so afraid of all the defects and stuff for having babies later, but we're seeing more and more of this happen, and these babies are fine. And, the most important thing I do believe going into later life pregnancies is our health as well. So if we're not treating our bodies kindly and you're trying to get pregnant, then you're definitely going to have increased risk for pregnancy complications. I think she means it's happening later, maybe because later, yes. Yes, I think so too. I get it now. I'm sorry. I was 17 and 20. I had just turned 18 when I had Logan, and then I had just turned 22 when I had Joanna. So I was young too, and I wouldn't trade it for anything now because, they're grown. My son was 20 and I was 38 years old. So I do, at the time I was like, oh my gosh, what have I done? But now I would not trade that for the world. But I'll tell you this, like I said, I had a hysterectomy at 25. My husband and I really wanted to have a kid together, and I couldn't. We looked at surrogacy. We had 2 failed adoptions. My body started craving it. Thanks, Sandy. If you're in the Discord, so if you have some topics you want me to talk about, put them in the Discord. But I love you too, Sandy. Thank you for modding for me. Have a good day. So anyways, let's talk about topics you guys would like for us to talk about in our next follow-up on Tuesdays. I do think that I want to talk about cortisol. I want to have a day where we really talk about cortisol and stress, because that's where, if we're trying to treat stress, we got to treat the cortisol. Otherwise, so I'd like to talk about that. I want to talk about insulin resistance / sensitivity. I want to talk about macros and how to do macros. We may hit that one early since it's the beginning of the year and everybody wants to really key in on their health right now. That was a surprise baby. Let's see. I was 22, 25 with my planned babies, and 30. I actually would have been happy with a surprise baby at 39, because my body was craving a baby at 39, and it still has been. I'm just thanking God that my baby's having a baby in a few weeks so I can get out of this wanting a baby so bad. So anyways, cortisol, stress, insulin resistance and sensitivity, and then how to count your macros. I have an excellent website that I recommend that really gets individualized numbers for y'all, so I want to spend some time doing that. My husband's getting his master's in physiology and kinesiology, and he'll be working in my practice offering individualized exercise and nutritional counseling, and this website came from that course that he's taken, because I sit right beside him and I learn with him. I do want to talk about that one. Telling you to shut up. TK, you would be a good little mama. Or I can't remember how old you are, TK. Did you say you were getting close to 40? So outside of those 3 topics, is there anything else? Cortisol, insulin resistance, macros. I had someone that really wanted to talk about the GLP. I'm going to have to really read the guidelines to make sure I can really delve off into this GLP. I see people doing it, but I get nervous about getting in trouble on here talking about that. They don't like those words. But I do believe in it. I love it. Quick question. Room temp versus, that's a preference. Either one. I personally cannot drink water and will not drink it unless it's cold. I do not just open up a bottle of water and drink it, but my husband does. So that's going to be more preference for you, how you like it at work. So thanks for coming in, A-hole. Yeah, I have to have the ice cold. I don't get it ice cold, but I have a section in my freezer that gets bottled water really cold, like the freezer, the refrigerator, and then there's this extra drawer that gets really cold, and that's where my protein shake, all the stuff goes. So that's really more preference. But cortisol, insulin resistance, macros, possibly GLPs if we can get away with that. I'm not really sure. I'd like to spend a little more time really on diabetes. That's one of those things that's not going to just be a daytime talk. Diabetes is huge. Thank goodness I'm not a coffee drinker. Oh, A-hole, I hope you're okay. I hope you didn't get hurt. Um, Other topics, you guys tell me what you want to talk about so I can make an agenda. Missy, is there anything that, as a provider, that you would like me to touch on? Um, you're excited about it. Okay. So we'll start with these. I'm probably going to spend next Tuesday only hitting on testosterone replacement therapy, only because we just have a couple of guys that really get in here. And I know Craig and Topher's kind of been waiting on that. When we have a little more guys jumping in here, then I will probably circle back to testosterone and really get into it, because I love testosterone replacement therapy. That's what got me to learning more about women's, because all the wives came and said, you got to help me now that you're helping my husband. But so I probably will spend next Tuesday kind of touching on testosterone. It's good for you women, so it helps you to understand what your man's going through. And then you can make suggestions for your man to go and do these things, since they're not in our lives anyways. So so we'll probably just spend that day, and then we're going to jump into the topics that we have on this list to really get off into and learn a little bit more about. Wendy, and Kelly and Missy, I'm going to send you the Discord link so y'all can get into my Discord. And I have all kind of different topics. I have cute little posters that I make that I give out to patients. I put on my Facebook, different things like that. So autoimmune issues, because that's what I'm dealing with, figuring out if there's anyone curious. So autoimmune is definitely something I'm passionate about. Autoimmune is not something we can just touch on in one day. There is so many autoimmune diseases, but we can definitely hit that as a topic, autoimmune. Because the thing is, at the end of the day with autoimmune, no matter what it is, once again, you circle back, you cut grains out of your diet. That's going to be your very first trigger for improving all autoimmune diseases. But but we can definitely get off on that. The labs that your providers, your initial primary care provider, can check to kind of initiate the process for getting you in with a rheumatoid. Yes, A-hole has the autoimmune lichens that we talked about. And A-hole, I will tell you, one of the best treatments for lichen sclerosis is low-dose naltrexone. We just have to be careful with recommending that for people, because if they're on any form of opioids, I have to be careful. But that is actually on my initial list over here for lichens, hidradenitis, and then we did the peri, the minnow, and the GLP. So we'll cover that in there. But I just went and got certified in doing and prescribing LDN back in October in San Antonio, and it is huge for treating autoimmune all the way around, but it is a great treatment for lichen sclerosis. So finding somebody that can manage LDN and titrate you up to the right dosing would be amazing. So you're seeing, yeah. So I actually do a lot of the labs for our rheumatologists, because I'm in a very rural community, and they getting our word into the rheumatologist takes anywhere from 3 to 6 months, just because he's the only one and he has to treat for everybody. So I've built a really great relationship with him. So I do a lot of his initial workup in my office, lab wise. So he has it. So when they get in to see him, he can hit the ground running with managing and treating those things. But I will tell you, at the end of the day, the first thing you want to do is cut out grains. No matter what kind of biologics, things that gets thrown at you, if you don't cut grain out, you're just throwing money at these things and hoping for the best, and still having flares and getting thrown on steroid burst and things like that, when you really just need to cut out grain out of your diet. So, all right, guys. Well, I am going to jump off. I love every one of you guys for coming. I appreciate every one of you for supporting me this week. And my 2-week break, my first week was because I was vacation. The last week was because we could not get off of an airplane in time for me to do this. I will be back next Tuesday at 10 o'clock. Eastern, and we're going to touch on testosterone replacement therapy for my two guys that have stayed loyal and faithful with me. I don't want to leave them hanging, and then we're going to jump off onto these other topics that we really want to get into. So love you all. Thank you so much for coming, and I will see you on our TikTok videos while we engage. Oh, let me show you two things. I don't have my books anymore because I gave them to my baby at the baby shower this weekend. But any of you guys that are looking for the most amazing candle, you need to try Kindred Wicks candles. This is my favorite flavor, the Apple Harvest. Her and Craig personalized my little sub-emote sticker, and they put it on my candle for me. So you can go check out Kayla that's here in the, today. She's got Kindred Wicks, and she makes the best candles. And then my friend Topher, he's one of the guys that stuck with me. He made me my customized hat. It says Gator Barfields on it, and absolutely love it. I was real picky about the particular hat I wanted, and he actually ordered it because he didn't have this one in stock, and made my customized hat just for me. So those are the only two things I can actually show you, because I actually have already gave my books, Kayla's book, A Kindness Blooms in Me. Her best friend told her, you need to read that book to this baby every night when she gets here so she ain't mean. So she was so funny when she said it. But and then of course I have my sugar manual, The Sweet Truth. I'm in the process working with Craig right now. We're going to get it to a little bit smaller size book and get it out on Amazon, out on the Zon, so that we can get it out to more people, because currently the one it's with right now, it's hard to push out. So anyway, I will see you all next week and on our TikTok as we engage. See you later.